Good afternoon, everyone, and thank you very much for inviting me for this conference. I'm very pleased to be part of this discussion about hepatitis B burst dose vaccination in Africa. I will present now our experience from the Gambia in the name of the Prolifica group. So the Gambia is the smallest country in Africa, which accounts 2.4 million inhabitants and has a high fertility rate and a high HPV prevalence, estimated at 9%, despite the introduction of the HPV vaccination in the 90s. Indeed, HPV vaccination in the Gambia has been introduced in February 1990 and is part of routine HPV vaccination program. And the Gambia is the first country in Africa to have adopted hepatitis B burst dose vaccination in 1990, thanks to the support of the WHO, the MRC Research Unit, and the Ministry of Health. And currently, the coverage of the 3 HPV vaccine doses is estimated over 95%, with the first dose received the first month after birth. The HPV burst dose vaccination is less good, and I will go back to that point a bit later. So the Prolifica program has been implemented in the Gambia in 2011. It's a population-based and hospital-based screen and treat intervention for hepatitis B. And as part of this program, we estimated the HPV prevalence in the general population, and we found it was quite high at 9%. And importantly, in subjects born after the introduction of the vaccine, the HBs antigen prevalence was also high at 3% in people aged 16 to 19 and 13% amongst men aged 20 to 29. We also found that subjects infected with HPV from mother to child are at higher risk of cirrhosis and liver cancer compared to subjects infected later in life. So clearly, we found that prevention of HPV mother-to-child transmission is key to eliminate HPV. And unfortunately, it's neglected in the Gambia. Indeed, pregnant women are not systematically screened for HPV, and antiviral therapy is not systematically given in women at risk of transmission to their babies. And hepatitis B burst dose vaccine is administered actually later than 24 hours. So in 2016, we conducted this study to estimate the real-life hepatitis B burst dose coverage in the Gambia. So we used the health demographic surveillance system and data collected between 2004 and 2014. And as you can see here, we estimated the HPV burst dose coverage at 1.1% only. And only 5.7% of the babies received the HPV burst dose at 7 days. So this finding is quite close to what we recently found. We conducted a systematic review and meta-analysis of coverage and time lapse of burst dose vaccination, and we found that the pool estimates for HPV burst dose vaccination was only 1.3% in sub-Saharan Africa. So we found that a low maternal education level, rural settings, and long distance from maternity centers were 3 factors associated with poor hepatitis B burst dose delivery. So in 2021, we've decided to conduct a study called Infant B to improve the level of knowledge about HPV mother-to-child transmission and to test, potentially test a strategy using the Inject hepatitis B vaccine device. So this study is an observational study in the Gambia, and we will start also in Senegal, but I will show you the preliminary results obtained in the Gambia. So we target pregnant women in urban and rural antenatal services We fill questionnaires about hepatitis B vaccination knowledge, and we present this very friendly device. I don't know if you've seen this device already. It's called the Uniject device. It's very friendly to use. It's a pre-filled vaccine system, which has been used in Asia, but never in Africa. And we ask them whether they would be happy to use this system, either themselves, if they give birth at home or in a non-medical system, or with the help of a community health worker. Then we test the mothers using a rapid point of care test, and we reassess their babies 6 months after birth. So this is just preliminary results because the study has not been completed, but since between January 2021 and May 2021, we screened 3,368 pregnant women in urban centers for now. And we found a very good uptake to screening, over 95%. We found a high prevalence of HBs antigen, and again, so 5%, again, despite the introduction of the vaccine in the 90s. The virological profile is still in progress. Importantly, we found that only 3% of them were previously tested for HBV infection. And sadly, amongst women tested positive for hepatitis B, none knew their HBV results. The level of knowledge about HBV vaccination was quite poor, irrespective of the maternal HBs antigen results. We found that more than 2/3 of women didn't know that their baby should be vaccinated at birth. These data, again, were collected in 2021 in big maternity centers. So maybe this result will be much different in rural settings. Most of the women gave birth in medical facilities, which is good news, but 8% of them still reported previous deliveries at home. Regarding the babies, the analysis is in progress. We still we have not seen the baby yet, but this is the preliminary results. Regarding the use of the Uniject system, we presented to the mothers this system and to the staff as well. We found that 2/3 of them would be ready to vaccinate their baby themselves using the system, and that could be a solution to improve the HPV birth dose coverage. But 1/3 of them were scared. However, most of them who were scared were quite happy to use this system with the support of a healthcare worker. So I would like also to discuss quickly about the potential impact of COVID-19 on hepatitis B birth dose vaccination in the Gambia. This is something that we are analyzing right now. I cannot give you firm results, but we believe that unfortunately COVID-19 have disrupted hepatitis B vaccination program. In 2019, we found, and this is not published yet, that the hepatitis B birth dose vaccine coverage was a bit better than the 1% we found in 2016. We found a coverage at 13% before the COVID vaccination. But we believe, unfortunately, that the COVID-19 has induced more deliveries at home, maybe a shortage of vaccines and a shortage of healthcare workers. So we believe that probably, as it has been observed with viral hepatitis services or other vaccination program, COVID-19 has induced a decrease in HPV birth dose vaccine coverage. So to conclude, even in the Gambia, which is the first country to have adopted and implemented HPV vaccination at birth 3 decades ago, strategies to improve HPV birth dose coverage are urgently needed. How COVID-19 will impact this birth dose coverage is unknown, but we believe that there will be consequences since COVID-19 has already severely impacted viral hepatitis services and other vaccination programs in Africa. Clearly, founders and policymakers have now a major responsibility to support the development and evaluation of interventions to scale up hepatitis B vaccination at birth and strategy to prevent mother-to-child transmission. So we still don't know whether the Uniject vaccine system is a response, but we clearly need to evaluate new strategies to improve this low hepatitis B birth dose coverage vaccination. Thank you very much. I just take the opportunity to thank all the Politica group listed here, and especially the people involved in this infant B study and the founders. Thank you very much.